Hi, thank you for watching our video. Today, we will be looking at the circulatory system, specifically the heart. The circulatory system has three main components: the heart, the blood vessels, and the blood itself. It has numerous functions, one of which is transportation. Today, we shall focus on the heart. Many of us dread studying the heart because we never know where to start. Well, let's start at the beginning. What does your heart do? In other words, if your heart was an independent sentient being and it had to tell you what it wants, what it really wants, what would it say? Well, Selena Gomez says, the heart wants what it wants. And scientists say that what your heart wants is to supply the body. To understand how the heart does this, we need to understand what exactly the heart is, how it does this, what causes it to be unable to do this, and what happens when it can't do this. So, firstly, where is the heart located? Puns ahead. If we are to believe Blondie, the heart is made of glass. Sandy Tom would have us believe that the heart is just a beatbox for the song of your life. Although technically Sandy Tom's definition of the heart is more accurate than Blondie's, the heart is neither a glass object nor a music playing device. So then, what is it exactly? Well, the heart is a muscular organ encased in a fibrous sheath known as the pericardium. And if we take Madonna's advice and open your heart, we would find that the heart is made up of 4 separate chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. The atria are separated from each other by an atrial septum, and the ventricles are separated from each other by a ventricular septum. These septa usually ensure total segregation of the chambers they separate so that their contents, usually blood, do not mix. The right atrium and the right ventricle have a tricuspid valve between them. The left atrium and the left ventricle have a mitral or bicuspid valve between them. These valves are normally one-way valves and therefore usually allow the flow of blood to occur only in one direction, from the atria into the ventricles. The right side of the body usually receives deoxygenated blood, with the right atrium receiving blood from the superior and inferior vena cava, which together contain all the venous blood from the entire body. When the tricuspid valve opens, blood is expelled into the right ventricle from the right atrium, which the right ventricle then empties into the pulmonary arteries when the semilunar valves open, which take the blood to the lungs. The left side of the body usually carries oxygenated blood. The left atrium usually receives blood from the pulmonary veins, and then when the mitral valves open, it empties that blood into the left ventricle, which then empties the blood into the aorta when the semilunar valves open. The aorta and its branches then distribute the blood to the rest of the body. Now, despite what some people might tell you, the chambers which make up the heart are not simply empty sacs. They are distinct structures with features which are specialized to suit their functions. For starters, because the left side of the heart, the left atrium and the left ventricle, supply the entire body and have to ensure that both the proximal and the distal parts of the body are supplied, and under very high pressures, and the right side of the heart only needs to send the blood to the lungs, which is not as great a distance and is under slightly lower pressures, the chambers on the left side of the heart tend to have thicker walls than those on the right side of the heart. Additionally, the ventricles have papillary muscles and chordae tendineae, which help regulate the opening and closing of the valves to ensure that flow is indeed in one direction. The atria and ventricles have many structures which aid their function and which help you as a student to identify them during your exams. Like all organs, the heart has a blood supply and innervation. The heart mainly receives parasympathetic innervation from the vagus nerve, cranial nerve 10, which decreases the rate of the heart as well as decreases atrial contractility. The heart also receives sympathetic innervation, which increases the rate of the heart as well as increases the contractility of the heart. Anything which affects the rate of the heart is said to be chronotropic. Think chronological and therefore time, chronotropic. Anything which affects the contractility, on the other hand, is known as inotropic. Therefore, the sympathetic nervous system is a positively chronotropic and positively inotropic system, whereas the parasympathetic nervous system is a negatively inotropic and negatively chronotropic system. The heart's blood supply is made up mainly of the coronary arteries. Think coronation and therefore crown, because this is what these arteries look like around the heart. The coronary arteries arise from the ascending aorta as it leaves the heart and go around the heart like a crown to supply it. There are two main coronary arteries, the right coronary artery and the left coronary artery. The right coronary artery has branches including the sinoatrial nodal branch, the right marginal branch, the posterior interventricular branch, and the atrioventricular branch. The left coronary artery, on the other hand, also has branches, mainly the circumflex, the anterior interventricular, otherwise known as the left anterior descending or LAD, and the left marginal branches. Together, these arteries ensure that the whole heart is supplied. Not so fun fact, when complete blockage of one of these arteries occurs, then an infarction may take place of the myocardium, and therefore you might have a myocardial infarction, otherwise known as a heart attack. Time for a quick recap. The heart is a muscular structure which consists of 4 chambers, which receives blood from the coronary arteries, parasympathetic innervation from the vagus nerve, and whose main function is to maintain the blood supply of all the organs in your body, and therefore you. Most importantly, we have also learned that heart attacks are usually a result of falling in love. Heart attacks are usually a result of a blockage of one of your coronary arteries. Also, we have disproved one of her other suggestions, which is that you give your heart a break, because if you give your heart a break, you would probably not survive. So don't give your heart a break, especially if you intend to live. One could say you should not take her lyrics to heart. Well, thank you for watching our video. I hope you enjoyed it and that you had a total eclipse of the heart about studying the heart. Okay, that was the last one. Do not forget to like and subscribe for more fun content. Bye!